Good day, soldiers. Right now, I'm here
Good day, soldiers. Right now, I'm here with Adam, the master trainer of MTT.
Hi, Adam. How are you?
Good, man. Nice to meet you.
Hi, Adam. How are you?
Good, man. Nice to meet you.
Adam, just like to ask you some questions.
I'd just like to ask you some few
What's
questions.
MTT Blade all about?
What's MTT Blade all about?
So it's all about movement. So our whole goal is to create better movement with our clients and patients. So we teach personal trainers, fitness coaches, physical therapists, and chiropractors how to properly assess with different fitness tests, and you take what they do in assessments and help their clients move better through different exercises.
For you
and
to
movements.
attend this course,
For you to attend this course,
if you're
you should be a physiotherapist or
You should have schooling or certificate in fitness training, physical therapy, chiropractic, or currently in school for one of the professions.
Next question. Why did you choose the
Next question. Why did you choose the
Well, we actually teach this course in different
Well, we actually teach this course in different countries all across the world. The Philippines we come back to most often. We find the fitness trainers and the coaches and physical therapists here are most dedicated to learning and making the craft a lot better. You can see behind us here we have a full group of over 30 practitioners that always want to do more, learn more. It's one of the countries that we find next to Canada and the States that always invest in their skills to learn better and
should
do
never
more.
stop? And compared to other countries,
compared to other countries,
what do you think about the fitness scene here?
what do you think about
growing.
the
I've been coming here for the last 4 to 5
It's
years.
growing. I've been coming here for the last 4 to 5 years, maybe since 2000.
It's really growing. So a lot of personal trainers here now are learning.
It's really growing. So a lot of personal trainers are now learning they need to invest in
It's
their
not
skills.
just about the
knowledge, growth.
certification where they
It's not just
stop.
about the certification where they stop. They always want to learn more how to help their clients improve and do better in everyday
Last
life.
question, Adam. What do you think would be the edge of a
What do you think would be the edge of a
fitness
fitness professional?
Well, the first thing is actually identifying their client's needs.
Well, the first thing is actually identifying the client's needs properly. So it's not just a cookie cutter program, it's how to identify every client individually and create a program that's tailored to them and not just the general group. So it's about the patient and the client and not just the overall. So this will be able to assess, identify, and create a program that's unique to that client.
Adam is going to be conducting.
Adam is going to be conducting.
Would you like to invite everyone?
Would you like to
For
invite
next course,
them?
October 10th.
Yeah, so next course is October 10th in Cebu, and then I'm going back here on November 24th and 25th at Fitness Army for this 2-day course to blading, assessment, and company. No problem. Thank you.
Alright, Adam, so now that you have told us
Alright,
about
Adam,
the
so now that you have told us
can
about
you,
the
show
MTT
us
blade,
how it's done?
can you show us how it's done?
Yeah, so this is the MTT blade.
Yeah, so this is the MTT blade. It actually stands for Myofascial Mobility School. So our whole goal with this is to create mobility in the myofascial system.
Muscles,
Stuff like
ligaments,
your
tendons.
muscles,
So the way we
ligaments,
use
and
is very
tendons.
simple.
So the
The
way we
client
use
comes
is
in with
very
pain,
simple.
we have them go
The
through
client
different
comes in with
exercises
pain.
to
We
find
have
where
them go
that
through
pain
different
actually
exercises to find where that pain
With our
actually
client
is.
here, when she has
With our
pain
client
down
here,
from her
when
hip,
she has
into
pain
her leg
down
because she's
from
a
her
runner.
hip,
So we're going to
into
take
her
a
leg
little bit
because
of
she's a
cocoa
runner.
butter through
So
here.
we're going to take a little bit of
Apply
cocoa
it
butter
onto
through
the
here, apply it onto
Now
the
she
skin.
can have a past injury, or
Now
she
she
can
can have a past injury, or she can
overworking,
have
overrunning.
just
So we can either
overworking,
prevent injuries, or
overrunning.
we can
So we can either
also,
prevent injuries, or we can
help
also
rehab past injuries. The way
help
we're going to do this,
rehab
we actually
past injuries.
slide the
The
tool
way we're going to do
over
this, we
top
actually
of the cocoa
slide
butter
the tool
to find
over
out
top
exactly
of
where
the
to
cocoa
feel
butter
those
to find out
myofascial
exactly where
juices
we feel
or
those myofascial
I'm going to do
juices
it
or
a
those
couple
muscles.
times.
I'm going to do it a couple
At all
times.
the
This is not painful at all. It's actually very comfortable and very relaxing.
Going to apply it.
Very relaxing.
Once I find a lot of those bumps and
Once I
adhesions,
find a lot of
I'm
those
going to
bumps
pull
and
the skin
adhesions,
away,
I'm going to
apply
pull
a
the
couple
skin away
more firmer
and apply a
strokes
couple
just to
more
break down
firmer
those
strokes just to break
Once we do
down
it for
those
about
adhesions.
20 to 30 seconds,
Once we do it for
we go
about
through our
20 to
stretching,
30 seconds, we
and our
go
rehab
through our
exercise
stretching,
help loosen
and then our rehab exercise and help loosen
So it's like a deep motion.
So it's like
very similar. Our whole goal is not
very
to
similar.
massage
Our
muscles,
whole
actually
goal,
to
not
move
to
better.
massage muscles, actually get to move better with each other.
Alright, soldiers, right now I'm inviting you guys to join Fit Academy.
to join Fit Academy. We got limited slots available, so enroll now. If you want to boost your career into the fitness world, so drop us a comment, comment your email address, or send us a direct message so you can have all the details
See you in the
about
class
Fit
soon.
Academy. See you in the class soon.
Okay, so welcome to our webinar today. We kind of start off with a small intro of one of our past courses with what we've done. It just kind of shows a little bit of background about the M2T blade. So my name is Adam. I'll be taking you through the pediatric webinar today. We still have a few people still logging in, coming into the chat here. So you should be able to hear me, and you should be able to see a M2T blade instrument-assisted soft tissue mobilization. This is webinar pediatrics. So today we're going to take you through how to properly work with kids, whether you're using instrument work or any kind of soft tissue manipulation. Kids is a huge factor if you're a clinician or a fitness trainer to work with to really expand your business and grab more and get more patients as well. So let's get started. If you do miss this, we are recording this. We do have a chat box on the bottom right-hand side as well. When I'm going to the webinar today, I'm going to try to answer a lot of those questions. But again, if I miss them, copy and paste that in that chat box so I can make sure I get back to it at the very end of this webinar. So like our video said, so we're the M2T blade. So it stands for myofascial mobility tool. So our entire goal is to create mobility within the myofascial system. Our company, we develop courses to create movement and mobility and strengthen. Our courses are primarily for physical therapists, chiropractors, trainers, and students to kind of learn more about functional assessment, anatomy, dysfunction, and how to treat it. So a little bit more about us if you haven't heard from us or just the third time. I know that I see quite a few people on this webinar today that have done our webinars in the past. So I'm not going to spend too much time on the, we'll call it housekeeping stuff, but so we can get right into our pediatrics. So a little bit about our company. We developed the M2T blade. When you saw that video at the very beginning of this webinar, that's our blade. That's kind of the first thing we've developed 7 or 8 years ago. We started off actually doing these courses in Toronto and Darmstadt, Germany back in 2013, 2014. Now we're in about 55 countries across the world. We also have Vigor kinetic tape. So the cool kinetic tape that we actually put your logo right on the tape. We are going to give you guys a little bit of offer on that tape as well. It's really cool. You pick the tape color, send us our logo. We place it right on the tape. I'm here based in Hamilton, Ontario. If you're in Southern Ontario right now, we're actually getting a huge snowstorm. I'm sitting in my office just outside of downtown Hamilton. You can probably hear the plows and stuff, and the salter trucks going by my window right now. So we did hit a little bit of a snowstorm this morning. I know we have lots from Asia, the east coast of the States, Australia. So our warehouse is based in Hamilton, Ontario. We're about half hour away from Niagara Falls, Ontario. We're right in the brand new cotton factory. So if you're from Southern Ontario, it's kind of the iconic building of Hamilton that we turned into a big warehouse, which is really cool. We also have a warehouse in Manila, which is all the stuff from Australia, Asia, India gets shipped out of Manila. We develop courses on proper utilization of the M2T, corrective mobility exercise selection, and integration into practice. So our new thing that we have, so really cool one guys talk about. We do have this new massage gun. I know it's kind of, there's a lot of them out there. It's a little bit trendy stuff going on right now. This picture in this webinar is our old model. We're actually selling those really cheap. We want to get rid of the old stock. So if you want an older one, a discount with the warranty and the course, just shoot us an email at dave@m2tblade.com. We have a brand new one, Stealth Blue. It looks really, really cool. If you go to our Facebook, you actually see the new Stealth Blue where we put your logo right on the massage gun. So we still have the M2T blade logo on that massage gun. We also place your logo, so it gives you a little bit more branding as well. So we have a little bit of a sale on those. They're not as cheap as the model you see on the picture right now. But again, they're great. We put your logo. It's usually $75 Canadian. We put on you at no additional cost, which is really cool. One thing we're doing January 9th as well is we actually have a canine instrument course that we're coming out with. The course, if you work with animals or dogs or small dogs, myself, I have a 10-year-old Boston Terrier chocolate lab. He's got more of the hips of a lab, so he has a really hard time walking up the stairs, doing all that kind of stuff. So we actually do a lot of massage gun treatment, and we do a lot of instrument work as well. We use the same instrument as the M2T blade. We actually have two of them. We have a smaller version. So if you do have a smaller dong, you can use a smaller version, or you can use the original version that we talk about in this course today. So one of my passions is actually working with canine and working with dogs, and that course is really cool. So January 9th, we're coming out with that one. Like I said, so in the videos of that course, it's all online that you can attend through it there. You can see my dog, his name's Lewis, he's a little bit overweight right now because it's really cold and snowy outside, so he's not as active as he should be. We're trying to fix that right now. which is probably going to help his hip issue as well. But we do a lot of massage, a lot of blading, working on all the anatomy of the animals and of the dogs. It's one of my really cool things I'm really excited about in the new year. Kind of want to get through Christmas so we can start teaching these canine courses as well. So a little bit about the background here. So the M2T blade, we're diverse all-in-one tool, but we are about movement. Our goal today is not just to sell our tool or talk about our tool. It's about to talk about movement. Doesn't matter if you have our tool or someone else's tool. Our mission as a company is to help 1 million people worldwide, help those people. So if we can help 1 million people worldwide, that's our mission. So we do that through webinars, live courses, virtual courses, and selling our products. We want to make sure that we deliver the best possible information that you guys can take from this webinar today and apply it right away. Right? So we want you guys to, this is not about a selling webinar, this is about education. So it is a little bit branded, it is about our product. But again, we're going to talk about pediatrics. Besides canine, I just talked about, I love working with kids. I started my career working with young athletes. I used to develop hockey players from clinical and fitness, working them through the development process through the minor hockey OHL, and we still have about 8 or 9 kids from that program that are in the NHL now. So we want to teach you guys about movement, how to properly assess movement. We have a couple other things as well. So we also talk about frozen shoulder. So this is going to be a small course that we're doing as well. We will be doing a webinar on frozen shoulder. If you work with patients that experience frozen shoulder, it's a must that you jump on this webinar on Friday. It gives you guys a lot of new inside looks on how to deal with frozen shoulder. If you go over to our Instagram account, you can see a lot of practitioners that treat frozen shoulder with a high success rate just based off of simple information. Now, we're not going to say we're curing it in one treatment. It's all about creating proper movement, creating proper assessment, applying the techniques that we educate on. So what you're going to gain from this webinar. So the 5 things that we're going to talk about. So we are going to talk about the foundations of instrument work. If you have taken this course, it is a great review. Also, it's a time to kind of grab a coffee, go to the bathroom, because again, it's the information that we talk about quite a bit. The reason why we want to review this kind of stuff, if you haven't been on our webinar or haven't done a course in over a year, we have changed it slightly as new research and education stuff has come out. We're also talking about functional movement, the development of a child, conditions of what you can treat, and the application of instruments with children. So yes, that's the #1 question that we get is, can I use instruments with children? Yes, and we're talking about how you can actually do that. So before we start, we must know where to treat. So like we talked about in every webinar, we're not going to go through the entire assessment protocol in this webinar. We're going to skim through why it is important to go through an assessment. If you want to do one of our webinars, we have a ton of recordings on the assessment base. We can email us at education@m2tblade.com. We can send that right over to you. So before we do any kind of assessment, every time we do any kind of treatment, we must properly assess and know where to treat. This is vitally important so that we're treating the body for movement, especially when it comes to kids and younger adults up to teenagers. Any kind of injury or mistreatment or unbalance can affect them for the rest of their life. So treatment is not just going to be a short-term, it's going to be long-term to make sure they move through their entire life. Sorry, I'm trying to be quiet. They're plowing outside. I don't know if you guys can hear all the plows go. We just had a ton of snow dump in this area within the last hour, and it's kind of really, it took me about an hour to get into work for a 10-minute drive today. So before assessment, so we have 3 steps that we need to do. So we got dynamic movement assessing, which includes muscle testing, treatment, and the corrective techniques. As you can see at the very bottom here, these are going to be our steps to make sure we have a proper treatment. So we assess, treat, and correct. On the right-hand side of our paradigm, we see typically practitioners follow on the right side. They do a little bit of assessing, a little bit of corrective, and spend most of the time treating. Especially when it comes to kids, less is always more. Less exercise, less hands-on treatment, we get more of a profound effect. Their bodies are changing so fast and so dynamically. We just want to help point them in the proper direction. Over-treatment is a big thing when it comes to kids. It's less is more when it comes to pediatrics, when it comes to children. So we want to spend a lot of time assessing, a little bit of time treating, a little bit of time correcting. So first with our assessment, we're just going to talk about the 3 steps we just talked about here. So assessing should be the cornerstone of any kind of treatment program design performed at each treatment. So this is not just something we do at the very beginning of each session. We want to do this every time that patient, that child comes in, whether it's squatting, whether it's lunging, whether it's push-ups, whether it's thoracic rotation stuff. Every time they come in, we must do a proper assessment. We're always going to start from that global to specific. So we want to see how the kid moves from their toes to their shoulders. If they come in with just an ankle injury, we need to see how the rest of the body is affected by that ankle. Like, again, we're not going to talk about too much about kinetic chains in this webinar today, but again, there's a kinetic chain that the body is connected by one. Once we go through our assessment, we go into our treatments. So with our treatment, we want to retrain movement patterns, get the child to move properly. I'm going to jump down to the third section here where it says mobility, stability, strength, and movement. Number one thing is we want to create mobility. We want to get movement within the joints or in the tissues. Then we want to create stability, strength, and movement patterns. And last but not least is going to be correctives. So corrective techniques will be determined from the assessment and reinforce the treatment and movement. This can include, but not only to foam rolling, strengthening, various flexibility techniques, and agonist-antagonist techniques. So pain. Children perceive pain very differently. Pain is just a signal going to the brain that something's going on in the body. The biggest thing is that children in pediatrics, they perceive pain very different that myself or yourself would normally perceive pain. Pain is just a signal going to the brain that something's happening in the body. We don't want to be practitioners that just chase pain. We want to identify the pain and create better mobility so the pain lessens. So children in pain. So pain is the one most misunderstood, underdiagnosed, and undertreated and untreated medical problems, particularly in children. One of the most challenging roles of medical providers, such as yourself, as surgeons and children, is to appropriately assess and treat their pain. Kids do not have the vocabulary, the words to properly express what's going on in their body. Now, we do need to do a proper intake. There will be practitioners out there who say, well, we don't want to chase pain. That is correct, but we need to still know what's going on in the body. We will find most of our assessment coming through, or most of our findings through our assessment. Great practitioners can see what's going on in the body through movement, range of motion, and palpation. Assessment of pain in children is linked to their level of development. Children of the same age vary widely in their perception and tolerance of pain. Every child will experience pain at one time or another, whether it's from everyday bumps and bruises or due to more chronic conditions such as headaches, gastrointestinal problems, or diabetes. In fact, 40% of children and adolescents complain of pain that occurs at least once weekly. And chronic pain affects at least 15 to 20% of children. So this is the biggest thing that we're seeing with adults. When I was a kid and I complained of any kind of pain or something's going on, my father would just say, brush it off, suck it up. With kids, we're kind of getting away from that because we're understanding how the human body moves a lot more. If a kid hurts themselves and has any kind of injury or movement pattern dysfunction, that can affect their life. Move on. We're going to talk about how the fascia is different between pediatrics and adults like you or myself, and how the development of that fascia can affect them when they're 40, 50, 60 years old. So with our patients in our clinics here in Hamilton, we really educate our patients about their kids, right? So from a business standpoint, we get more appointments and more patients in just by talking to our patients. We educate our patients that child perceives pain differently, that it's good to bring them in for an assessment. Even if they just do assessment, take them through functional movement, range of motion, even just an assessment, giving them proper exercise and a little bit of manual therapy once every couple of weeks is great to prevent the child from helping the child develop properly and live a great life. So pediatric pain stems from a wide range of chronic conditions, usually muscle, bone, or joint, headaches, and abdominal pain, and will require pain management and decreasing pain. But the medical community has not placed the same emphasis on pain management for pediatric patients as it has for adults and seniors. Each year, 1.5 billion children have surgery and many receive inadequate pain relief. In 20% of cases, the pain becomes chronic through their everyday life. So pediatric pain is, so a couple things here. Pediatric pain is neglected and untreated for several reasons. Children and adults react differently when it comes to pain. Doctors focus on the source rather than focus on the source rather than the symptom. Many physicians are so focused on determining what is causing a child's pain, they fail to perform pain management. Some physicians don't understand that pediatric pain management. They don't know how to work with a kid, or they don't know how to talk to a kid about what's actually going on in their body. So how can we talk about if a child has pain? So how can we notice that what's going on in the child's body? So first thing is they're going to favor one arm or leg over the other. You actually see a little bit of imbalance between the two. Decrease in physical activity. Now, this is not being lazy or lethargic. This is just they have decrease in wanting to do stuff for physical activity. Changes in appetite or sleep pattern, avoiding eye contact with other children, crankiness, irritability, and unruly behavior, nonverbal expressions of pain such as gasping, wincing, or frowning, physical cues like dull eyes, flushed skin, rapid breathing, or sweating. Another way to help children is to go over the list of words that help them express pain. Again, a lot of children do not have the vocabulary yet to help express what's actually going on in their body. With the kids that we work with that are hockey players on ice, we talk to them and educate them how to actually communicate with us properly so we know what's going on. We can ask the proper questions and the children can talk to us about what's going on in their body. Last but not least, this is the most important thing. I know it kind of goes against what I just said, but don't rely on just the verbal. It is great to ask questions, whether you're working with adults or kids. Ask children to point their bodies and show them where they hurt and how the pain travels through them. So also using motion to show what's going on. Stats on pain in children. Of children aged 15 to 17 years old, 20% of them suffer headaches. We're actually seeing that number grow because of gaming, iPods, inactivity, and not doing sports. More than 1/3 of children complain of abdominal pain lasting 2 weeks or longer. Juvenile arthritis, which causes joint inflammation aches, affects nearly 250,000 people under the age of 16 years old. So, like my father said when I was a kid, what happens? Just suck it up. Don't worry about it. You're going to bounce back. So what happens if we don't treat children and we don't work with children? So if we leave these conditions, complaints, or dysfunctions unaddressed, chronic pain can affect children in ways that will follow them throughout their entire lives. Now, like we said at the very beginning of this webinar, it's not just going to affect them within that year. It will. They'll experience pain, lead to further damage to their bodies, but it's also going to affect them 20, 30, 40 years down the road. They can develop emotional and psychological scars from the pain that can taint future choices in their lives and healthcare. Untreated pain in childhood can also lead to chronic pain in adulthood and old age. And like I said, we'll talk about the fascia and how the fascia differs from an adult to a child and how that affects them down life. So where do we start? Again, health history and going through a movement. So we're going to start off with our dynamic movement testing. Again, whether you're working with an adult or a kid, we always want to take them through the dynamic movement testing. So movement predicts function. How the form of my body is going to predict how I actually move. Children need to move in everyday situations. If they're not moving properly, we're going to have that wear and tear going unevenly through the body that can cause issues and dysfunctions long term. So when I'm going through our kinetic chains, the body is going to move into synergistic patterns. We want to see how the body moves together, where we have breaks and where the body is. So if you haven't seen our webinars in the past, here's a couple of chains, just how the body affects one or the other. These are just 3 examples of kinetic chains. The one part of the body can't move independently of the other part of the body. I always tell my patients, pick up a fork with one finger. We need multiple muscles, joints, and nerves to move together properly. So if someone experiences low back pain or a child has pain, hips are going to be tight, core is going to be sloppy, and the thoracic spine is going to be tight. If somebody has knee pain, so the ankle is going to be tight, low back is going to be sloppy, so sloppy means tight and weak, and the LPHC, which is the lumbopelvic hip complex, is going to be tight. And the last one is shoulder and neck. So if we have shoulder and neck pain, so the pecs are going to be tight, shoulder is going to be sloppy, and the scapula is going to be tight as well. So let's kind of get into that. So we kind of just touched on briefly of pain. Now we can talk about pain a full course. When we teach this course live or your online course, this is a whole chapter just on pain, how to break those verbal cues with pain. Again, it's great to research about how to work with kids in pain. kids in pain will verbally explain to them very differently. They may not even explain to you. So we're talking a little bit about that fascia and stuff here. So first, with instrument-assisted soft tissue mobilization, if you haven't seen this before, is a new form of treatment of the fascia and the connective tissue. We did this video at the very beginning showing how the blade actually works across in the top of the skin. So the ergonomic design of our blade allows the therapist or trainer an extremely efficient way to track down disorders and to treat them. So this tool is used as part of the assessment, whether you're working with kids or adults, to assess and treat those pain points. So a little bit about fascia. Fascia is what we're going to be treating. So the fascia system has been termed by Grotz in 1938 as a functional joint because it provides strength, structure, extensibility, and flexibility all in one. It weaves itself through muscles and ligaments, but not only that, the head, brain, nerves, and organs. So how it differs in children. So the fascia makeup in pediatrics and children. So children and infants are new to gravity and the way it pulls and affects their bodies. They need time and movement to adjust their new way of being in open space. Their role for the first 9 months is fluid-filled bubble, a warm, safe space designed for them to thrive and develop to protect from the effects of gravity. After the birth, the baby's tissues quality starts out more like water and extremely pliable and responsive as it learns and adapts to new surroundings. So that's what I want to highlight it, underline it, write it down. The child's body is adapting and is pliable to the surroundings. So if we have a child that's not moving very well, it's going to adapt and be pliable to that position of it moving. So due to this, also, it's easier for the therapist and parent or caregiver to release the fascia, and children tend to be more responsive to therapy than in adults. So that's like we talked about at the very beginning of this webinar. Less is more when it comes to children. Their fascia and their tissues are way more pliable than someone like mine or yours. So with a myofascial adhesion, so think of fascia as your body wrapped in fishnet hose, both internally and externally. Over time, the fishnet hose gets entangled and require adjustments. If not, you'll develop impingement. Fascia is going to work in the same manner. Once the fascia becomes entangled, impingement occurs. It may impinge blood circulation, muscle movement, or nerves in the body. Over time, myofascial adhesions occur as a result of unintended impingements. So here's a myofascial adhesion in between the two tissues. So it doesn't matter if you're a child or an adult, the body and the tissues need to move over top of one another. If we have too much friction or dysfunction or movement that's not happening, we're going to have a buildup and it's going to get stuck together. So how we fix this condition is going to be instrument-assisted soft tissue mobilization. When a tissue is damaged, it will heal in a disorganized pattern, forming an adhesion and scar tissue. These adhesions will lead to limitations in range of motion and an increase in pain. Instruments and tools are used to aid in the practitioner's ability to detect these adhesions as well as treat them. We use these tools to restore the quality and dysfunctional soft tissue. This is achieved by introducing microtrauma to the tissues, increasing inflammation, and speeding up repair within the body. So how it works. So soft tissue adhesions prevent the fluid movement of muscle, tendon, ligament, and fascia. As our MT2 blade instrument glides over the adhered tissues, the stainless steel tool will reverberate the feeling in our hands. Like a stethoscope amplifies the sounds of the heart, the M2T blade and instrument-assisted soft tissue tools, such as the MT blade series, assist us in finding the exact areas of restriction. They're going to help us break down myofascial adhesions and reduce or eliminate adhered fibers, restore function, and decrease pain. So a little bit about the blades. A lot of people, I think, have been on this webinar before. So if you haven't, we showed that nice video at the very beginning of this webinar. So the MC blade is a double bevel with both a superficial and deep treatment edge. It has 8 treatment points to affect all areas of the body. It has integrated handle for increased controls and outcome. Can be used in either hand. It's made here in Canada, and we use it out of stainless steel. We also have a really cool custom blade one as well. We put your logo and your name right into the tool. So there's 7 colors that you can pick between gold, rainbow, purple, blue, black, silver, rose gold, which is one of our favorites, the number one selling. You can pick a custom color. We actually, number one question, if the tool is not coated, we actually take the material with that color. So it's the same quality as the surgical grade stainless steel. So currently we use this in about 55 countries. I think we're up to 60. If you're on our Facebook page, we actually just launched the first course in Kuwait. So we're in Kuwait February 25th, 24th, 25th, 26th. We're doing our Foundations to Movement, which is our instrument, cupping, blading, and we're also doing our new mile stretch course there as well. So if you're in the Middle East or you're in Kuwait, I know we have a huge following in that region of the world. We're actually cutting off registration for 15 people. I think we're already at 12. Email Lynette at mttblade.com and she can get you the information about that course. So here's a little bit of a picture of the tool. We talk about 8 different treatment points. Okay, so here's the 8 treatment points. Instead of having multiple tools, you only need one tool to assess and treat all areas of the body. So using it to detect faulty tissues. Once the area of interest has been narrowed down, the assessment of the entity is used to find specific areas of restriction. We do a sweeping or scanning motion over the adhered tissues, so there's a tactile feedback felt through the instrument and into the practitioner's hand. Once we determine the areas to treat, we want to use an emollient cream or lotion should be applied to help the skin irritation, prevent skin irritation. Tissue should be treated from superficial to deep. The MTT is always held at a 45-degree angle to the targeted tissues. The MTT can be pushed or pulled, but should only be used in one direction at a time. Only moderate pressure through the tool is needed to affect the tissues. So in an adult, we say about 4 to 6 pounds of pressure. In a child under 17, about 2 to 3 pounds of pressure. Now treating children with instrument-assisted soft tissue mobilization. So how we actually use this to work with kids. So the fluid fascial network that lives between each cell in your body consists of bungee cord-like fibers made mostly from collagen, including retinacular and elastin. These fibers run everywhere and are denser in certain areas such as tendons and cartilage, and looser in other areas such as the breast and pancreas. The other half of the fascial network is a gel-like web. Your cells are glued together with gel-like substance, which is everywhere. It is more or less watery depending on where the body condition is. When we're treating children with instrument-assisted soft tissue mobilization, as children, fascia will be more gel-like and moldable. So we need less pressure. So like I said, about 2 to 3 pounds of pressure. I even say less than 4 pounds of pressure. The research shows 4 when treating children. So we're going to do broad, fast strokes. We want to do less duration as well. So we're only doing 20 seconds per area, 4 body areas max. Okay. With an adult, we may do up 20 or 30 different kind of areas in the body. With the child, we keep it maximum of 4 areas, and we keep it 20 seconds per area. So that means the treatment time is very, very less. Like we said, children, their fascia is more moldable, more pliable, so we want to spend more time with exercise. So exercise is always is a must post-treatment instrument-assisted soft tissue mobilization. Our whole goal is we want to re-educate the body on how to move properly. We also want to prevent issues later in life and supports proper development. So the human body works in a way that it works in the most comfortable way to save energy. If a child is not moving very well, we want to break that pattern and get them moving properly. We'll use our instruments or our cupping to break the pattern and our exercises to retrain their body how to actually move. So we only want to spend a little bit of time doing our manual therapy-based work, and a majority of the time is re-educating with those exercises. We want to focus on general dynamic movement, which is squatting, lunges, and shoulder mobility. Once we've created how the body is moving, we want to go to specific, which is our agonist and antagonist. Specific areas, keeping it 5 to 12 reps at a time. Okay. So that's our entire webinar that we have today. We do thank you for joining our pediatric webinar. It is a lot of information. There's more for you guys to actually do. This is just kind of the tip of the iceberg of how to work with kids. It's a great population to work with, as we're always going to have children that always, especially with the way that kids are moving, or I should say they're less moving nowadays and they're more inactive in most cases. If you have any questions, always email us. You can email us directly at dave@mcdblade.com. If you do have a general question, email support@mcdblade.com. We'd love to hear back from you guys. On Friday, we do have our frozen shoulder webinar. If you want to attend the frozen shoulder webinar, just email us at support@mcdblade.com, and we'll get you over and registered for that link. If you're in Southern Ontario or across Canada, be safe in the snowstorm today. If you're not in this area of the world, enjoy the nice weather because it's not fun being in a snowstorm. We look forward to you guys being on our next webinar coming up. Have a great day.